Hello, I'm Dr. Che, and today in this video, we will talk about OET writing assessment criteria. And can anybody tell me, let us take Dr. Mubashir, why it is important for us to know OET assessment criteria?
To perform well, if you know the criteria, you can write a good letter.
Excellent, excellent. I have, marked letters for even native English speakers, and the problem was their English was too good. They were very good in writing, but they were not performing well in OET writing. The problem was they were not aware of their criteria. I had one student from Canada, and just 1 or 2 days before exam, he sent me a letter. His letter was above 360 words. Okay, and it was less than C negative grade or C like this. Okay, and his English was excellent grade. What we have done in just 2 days, 1 or 2 days, I have marked for him 3 or 4 letters. He just needed some guidance how to improve and how to fulfill OET criteria, and then he got 360 in his real exam in just 1 or 2 days. So that is why it is important to take some guidance and know the criteria. So this is my YouTube channel. If any of you that you are watching my video on YouTube, if you have not subscribed to my channel, just subscribe. It would be just a little bit encouragement for me to make more videos. Otherwise, I have good presence on Facebook. I don't need this. So first criteria is purpose. So let me take Miss Kate. Miss Kate.
Yes.
So why it is important to write a concise and to the point criteria and purpose in OET writing?
Because for better understanding for the reader, what is the target in
Yes,
your
doctor.
aim? Yes.
Okay, just let me explain because sometimes you people there is a
Network, doctor.
background noise. Okay, the here the importance of purpose is especially for all of you, not only for doctors, for all of you. Purpose you can see has 3 marks, 1, 2, and 3. If you don't get 2 out of 3 in purpose, if for example you get 1 out of 3 in purpose, even your rest of the letter is 100% correct, 100% correct, you will not get B grade in OET writing. You will not get B grade. This is the importance of purpose. OET writing assessment criteria has changed since August 2019. This is an issue for many students. This is an issue for many students. Why it is issue? Because you will see many model answers on old style. Okay, means when there were, OET writing assessment criteria was a bit different. So many letters are written at that time, before that time. They are not wrong according to that criteria, but from according to new criteria, they don't fulfill all new criteria. That is why we need to fulfill OET new writing assessment criteria. Many videos are according to this new criteria, but still there are some model answers, some videos about according to old criteria. So first criteria is purpose. Can anybody let me take Miss Priya, Dr. Priya, can you read it here, please?
purpose of the document is immediately apparent and sufficiently expanded as required.
As required. Okay. So first, let us take first. Okay. So purpose of the document is immediately apparent and sufficiently expanded. Immediately apparent means when you start reading the purpose, it should make a clear sense to the reader what is the issue of this patient. Purpose should be clear from the start, immediately apparent, and it should be sufficiently expanded. Sufficiently expanded. So in purpose, we write two important things. Number one, what is number one, Dr. Diana? What is wrong with the patient? Means what is the main issue of this patient? There is mostly diagnosis. Number two, what is number two?
The purpose of the letter.
Yes, in purpose. Number one, what is wrong with patient? Main issue. Number two.
And why we write from who we write the letter and the reason.
And the reason, what we want from the reader. For example, if you are writing a letter, patient is having diabetes, I'm writing to refer Mr. Che, who has, okay, let us take pneumonia, who has signs and symptoms of pneumonia. Your further assessment and management would be highly appreciated. Okay. Now let me show you another style. Okay. Now it is what we want is it clear. Okay. Now second purpose. I'm writing to refer Mr. Che, who has 3 children and 1 dog. He does not exercise regularly. He presented today with increased urination. Please assess him. Okay. What is the difference between these two purposes, Dr. Diana? What is the difference?
In the first, like it's correct, it's priority because
Yes.
we just say like
what is the main issue of the patient? What is the main issue of this patient? It is written here.
Yeah.
What we want like from the reader? It is written here.
Yeah.
In the second sentence.
Yes. And here you are not talking about what I have. Please, no background noise. So here we are not talking what is the issue of this patient. We are just talking here 3 children and 1 dog. What is this? We don't need to write this in purpose. These are explanations in body paragraphs. It does not exercise. No, these are not important things. We should mention the main thing. What is wrong with the patient? What we want from the reader? These two things. We don't need to add extra things. Okay. He was admitted on this date with this and this. So these are things that we need to avoid. So if your purpose is immediately apparent to the reader and is sufficiently expanded, means the things that you need to cover are covered in your letter. Purpose of the document is apparent, but it is not sufficiently highlighted or expanded. You can slip a little bit, still you will get B. Okay, 2. So if you get 2 or you get 3, so it is possible that you will get B grade. But if you get A, 1 or 1 plus in your purpose, you will not get B grade. So purpose is very, very important. It should be concise. It should be to the point. It should be immediately apparent to the reader. It should be sufficiently expanded. It should be not too long. It should be concise. Ms. Kate, it should be concise or it should be too long?
Concise.
Concise. Okay. Excellent. Concise, what does concise mean? To the point. Okay, not explaining a lot of things. The next criteria is content. Dr. Mubashir, can you tell me what does in general content mean?
Content means the all detailed history.
Okay,
We would
detail
elaborate the
is,
history.
yes.
Yep.
What is, included in your letter, content of your letter? Like, for example, if we talk about something, pizza, what is the content of pizza, what it includes? Okay, if you don't add salt in your pizza, then it would be not tasty. Okay, if you don't add cheese, it would not be good. Okay, so it is content of your letter. If you miss any important thing, then you will lose marks. Okay, content of your letter is appropriate to the intended reader. Let us explain me this part. Okay, content. So let me take Dr. Diana. Okay, let me take some doctor. No, other person. So Dr. Bubashir, if you are writing to a letter, as I have already recorded in my first video, according to the reader can be of what types, doctor? Do you remember? Number one,
Actually,
medical,
unfortunately, I didn't. Yeah. Medical
professional.
person, professional,
Other.
physiotherapist.
So I call them as semi-medical. Okay, this is my own classification. Semi-medical. Number third one is
Specialty clinic.
no. Specifically medical professional, non-medical.
Okay.
For example, if you sometimes in pharmacy letters, in nursing letters, you are writing to parents of the patient, to teacher, to school teacher. For example, in
Social
medicine
work
also,
also.
you are writing to a shelter home manager like this. So these are non-medical professionals. Semi-medical is like occupational therapist, physiotherapist. These people,
Optometrist.
yes, optometrist. These people, and doctor and nurses, I call them as medical professionals. So this is why I have divided them into 3 categories, because our content should be appropriate for the intended reader. First, we should see the reader is a professional. What kind of if it is professional, we can use medical terms. Okay, a semi-medical professional, we should use less medical terms. Non-medical, we should not use medical terms. This is one letter that is also available on YouTube. And patient is having, is a patient is of domestic abuse. And then you have treated this patient where the treatment was, a fluid resuscitation, antibiotics. Name of antibiotic, let us consider ceftriaxone. Okay, ceftriaxone. Let us consider surgical debridement of burns. Debridement. All of these, and many morphine was given for pain. All of these things. Now my question is, Dr. Mubashir, if you are writing this letter to a non-medical professional, let us consider a shelter home manager, will you mention all of these things? These ones, treatment.
No, I don't think so.
You will just mention he is being treated, he or she is being treated accordingly, or something in general.
Accordingly.
Don't need to mention these things. Okay. If, for example, you are a burn specialist, burn department specialist, you are sending this patient back to GP, will you mention how patient was treated? Yes, we can mention them. Okay,
Yes,
that
yes,
case, because we are
yes,
writing
of
to
course.
medical professional. So our
These are the
content,
relevant
yes,
information.
yeah, for the reader. So our letter changes according to the reader. Okay, and other thing is according to the reader. Another thing is according to type of letter. If it is discharge letter, you will focus on discharge, medication, and how patient was admitted, how was progress. If it is referral letter, you will focus on risk factors, symptoms, okay, these kind of things. So according to urgent letter, you will mention urgency, you will mention fast, important visit, all of these things. So your content is appropriate for the reader. It's the important thing. Number two is addresses what is needed to continue care. For example, if it is a discharge letter and you need to continue some medication, patient will continue taking these medications. Should we mention these medication when you are writing to, for example, back to GP? We should mention, okay, because the patient will continue taking these medication. Okay. Key information means the most important information is included. No important details are missing. All important details are mentioned, and content of case note is accurately presented. Accurately presented means you don't twist any information. You should write as it is written in your case notes, but in well organized way. Let me take Dr. Diana. Can you read here to get 5 marks what we should do?
Yes, content is appropriate to intended reader and mostly addresses what is needed to continue care. Content from case notes is generally accurately represented.
Okay, so yes, so when you transfer information from case notes into your letter, it is accurately presented. For example, if a patient is getting taking metformin 500 milligram, you cannot write 800 milligram. If patient is not smoking, you cannot write that patient is smoking, something like this. It's wrong information. So your content should be according to the reader. For example, if you are writing to a non-medical professional, we should not write analgesics, we should write painkillers. But if you are writing to medical professional, if you write painkillers, the specialist will say he is not a doctor or a nurse, he is writing painkillers. We should write analgesics when you are writing to a doctor. When you write to non-professional, non-medical, we should use simple terms, painkiller, like this. Okay, so to get B grade, we should, just let me tell you before we explain next. To get B grade, we should get at least 2 in purpose, and there are 5 more criteria, total in 6. Okay, so we should get 5 in each. Okay, 5 in each here and 2 in purpose to get B grade. Okay, so content is clear. No, this student got 3 or 4 in content. So will he get B grade? No. Conciseness and clarity. Anybody knows what is conciseness and clarity? Miss Kate, can you tell me, please?
It should not be too long,
Uh-huh.
and
And clarity
also
means?
clear. Just put the information you needed inside the content.
Exclude all irrelevant things.
Yes.
Clarity.
Yes.
Exclude irrelevant things.
Yes, that would be in content, doctor. Okay. Exclude irrelevant information. You're not writing any inaccurate or irrelevant information. Here, the information that you will be writing, it should be concise to the point. Here you can also say irrelevant information, and it should be crystal clear. Okay, I have marked hundreds of letters. When you read a letter for like this, and he presented this, and this. When I read a letter like this, I give B grade. When I need to stop, patient presented with numbness and vomiting. And he was given this medication. Then you are right, and his weight was lost, and this and this. So it is not well organized. So well organized, how we organize mostly medical information, we write symptoms first, symptoms, then signs, then any investigation, then after investigation any treatment, and any further plan, okay, like this. Okay, so these are things that we usually how we need to organize. First symptoms, patient presented with this and this, and on examination patient had this, and investigation showed this, and treatment was given this. But we need to join similar information. I'm just telling for as example. Okay, so conciseness and clarity. Length of document is appropriate to case. Who can tell me? Let me take somebody. JAS. Who is JAS? Can you talk with me, please? JAS. Okay, let me take ZH. Who is ZH?
Yes, doctor.
Okay, so I forget thing what are you going to talk. So conciseness and clarity. Anybody remember what we were going to talk about?
The length.
Length. Okay, word count. What is the average word count that we should write? ZH
180 to 200.
180 to 200. Okay, up to what it is acceptable. What is the maximum that we usually consider as acceptable? Let me take some of my students. Dr. Priya. Dr. Priya,
Yes,
please.
doctor.
Okay,
Yes, doctor.
what is the average word length that we should write?
I'm not quite sure, doctor, but let me guess. Is it 240?
No, 240, no, 180 to 220. Okay.
220. Okay.
Yeah, I have explained a lot of times in the class.
Okay.
So
Okay, doctor.
So it does not mean that you can write in every letter up to 220. If your letter is short, one visit letter, one visit case notes, then you don't need to write at least 220. Maybe you can finish in 170, 180, 190. So what they want to say is length of document is appropriate according to the case and reader. And if you know in OET, this is my perception and what I have learned so far, they don't count number of words. They don't count number of words. Because they don't need. They have marked thousands of letters. These examiners have marked thousands of letters. When I only see a letter, I have only marked hundreds of letters. When I just see a letter like this, okay, so it is too long. Okay, I can only imagine with just by looking at the letter. So, but as a practice, for practice, we should try to write between 180 and 220. Sometimes even you can finish in 170. Sometimes you can write a bit more, but it should be according to the situation. Even if you write more than 220, if case notes are longer and you could not finish and you have not included any irrelevant information, still you can get a good score. I myself, when I took exam almost more than 1.5 years ago, what is my imagination, but because I have not counted my words, but according to my experience that I was counting length of my page, I have written more than almost 220, but I got 400 at that time. And after that, my OET writing has improved a lot by teaching and by making courses. So what I want to say is that you should not include irrelevant information, even if your word count goes a little bit higher than 200 and 210 up to 220. So your length should be appropriate and you should write concisely. The problem is you doctor, you nurses are too busy. Even you cannot take free classes. This is the problem. You people cannot watch free videos. Many students tell me, just I don't have time. I have 3 days left. I need to, I need 3 letters corrected. I need 5 letters corrected. I could not prepare. I am intensive care unit doctor and I am working 8 hours, this and this. The problem is you people are very busy. That is why we cannot write very long letters. We should be concise and we should be clear. Especially clarity is for nurses. Your letters are very difficult to organize. It should be well you should explain and you should well organize your letter. So can any of you, Dr. Mubashir, can you read this one, this part?
Which part, doctor?
This one of 5 marks.
Can you?
This part.
Formants shared.
No, this
Sorry.
one. Length of document.
Length of document is mostly appropriate to case and
Reader.
this reader information is mostly summarized effectively
And presented clearly. Okay, you can see.
and presented clearly.
Yes, you should summarize effectively and you should present clearly. Okay. And if you include irrelevant information in your letter and this information distracts the reader from overall clarity of your document, you are just trying to summarize, but it is not good. It is partially successful. Then you will get 3 or 4 marks. You will not get 5. If you don't get 5, you will not get a B grade. So you should summarize effectively. You should present information clearly. Next is genre and style. Anybody knows just meaning of these words? What is genre and style? What do you understand by these? Any of you? Genre and style is the
It should
same.
be
Yes.
Formal word. There should be formal words.
Uh-huh.
No symbols.
Uh-huh.
No what you call abbreviation.
Abbreviation.
And,
No, this is not like abbreviation because we can in OET we can use abbreviation. Genre means according to the discipline, according to the knowledge. Means this is just like same the using medical terms, using don't for if your reader is common man, don't use medical terms and use formal language, don't use informal language. Okay. So for example, if you start like this, hello, how are you, Mr. Smith? You are presenting with this, and he was looking here and there, he got a fever, and this is street language. Here you need to use formal language. So your writing is clinical and factual. One important thing I just remember now, in OET is exceptional, unlike other English exams. In other English exam, you need to show off your English. Okay. You need to be unique from others. Okay. For example, unique from others. In OET, we should follow classical style. Here is just only purpose is to communicate the information of patient clearly to other person. Okay, other doctor, other nurse, other person. Okay, so this is difference between OET and other English exams. Here we don't need to you show a lot of synonyms and nothing. Just you need to convert case notes into sentences and paragraphs so that the reader can easily take a general overview of this patient and can understand the situation. This is what we need in OET. So your writing should be clinical and factual and appropriate to genre and reader. According to his discipline, if he is a doctor or nurse, we should use that. According to that, if it is a common man, we should not use technical things, medical terms. Technical language, if you are writing to a mostly medical professional, doctor, nurse, you should use technical language. Okay, means clinical language, medical language. Even sometimes we are not making grammatical mistakes, but your writing is not clinical, not in classical style. You will not get good marks. We can use abbreviations, common abbreviations in OET. That is not a problem. And we should use polite language. Polite language. If I say, if I'm writing to Dr. and I say Dr. Smith, okay, Dr. Smith, Dr. Smith, check this patient's vitals and admit him in your hospital. Take care of his vital signs. Take care of his vital signs. For any further information, call my secretary, okay, my assistant. So what kind of language it is? It is good language or not? It is not polite language. Check patient's vitals, okay, admit him in your hospital, take care of his vital signs. So we should, polite language would be, so I would be grateful if you could monitor monitor Mr. Smith's vital signs and admit him in your department. Please also take care of, please monitor his vital signs every 2 hours. And if you need furthermore this and this, okay, this is polite language. We need to use polite language. There are many more things that we use for polite language. So in OET we should use polite language, because many doctors and nurses, these people are not very sensitive people. If you use you know uh, not if your letter is not polite, is impolite, these people will get angry. So you should use polite language and according to the document and recipient. Okay, this is what we need in general style. So let me take Dr. Diana. Can you read this part?
Yes. Writing is clinical, punctual, and appropriate to genre and the reader with occasional minor inappropriacies, technical language, abbreviations, and polite language are used appropriately with minor inconsistencies.
So your writing should be clinical. Number one, clinical, should be factual, should be good, genre and style should be according to the reader. You should use technical language. You should use abbreviations if it is important. You can use them. You should use polite language, and you should use language with minor inconsistency, mean minor slips, minor errors. Okay. If your writing is at times sometimes inappropriate to the document, to the reader, according to the reader, and you are over reliant on technical language. Over reliant means you are dependent on technical language. You are using mechanically, okay, not in a very good and organized way, and you are using abbreviations may distract reader, and your abbreviations are not common, and your abbreviations can distract reader, then you will get 3 or 4 marks. You will not get C plus or B grade. That is why to get B grade, your style, your genre, your clinical, your document should be clinical, factual, use polite language, use abbreviation, but appropriate abbreviation. Don't overuse abbreviation. Your letter should not, make it difficult for the reader to understand the language. Okay, you should use technical language. This is to get genre and style. Number 5 is organization and layout. Your organization is very, very important. For example, let me take Dr. Mubashir. If your patient is having MI, okay, your purpose
Yes,
is
doctor.
I am writing to refer Mr. Che, who has signs and symptoms, okay, of MI, your further assessment and assessment and management. Okay, all of these would be appreciated. After that, you start like this. Second para. Mr. Che has 3 children, 1 wife, and 2 dogs. He underwent appendectomy in 2011. He eats junk food and he smokes 5 cigarettes per day. Then you say, Mr. Che presented to me on, presented to me 2 months ago with fever, runny nose, these symptoms of common flu. So common flu was diagnosed and he was given Augmentin, whatever, okay. Augmentin. Today he presented with severe chest pain, okay. Chest pain, etc. These things, okay, doctor. No,
Yeah, I'm listening.
yes, no. After reading this letter, what do you think about this doctor who is sending you? You will say, doctor, are you, yeah, you are mad because you are sending me this patient with myocardial infarction. You are telling me he has 2 dogs and 1 wife and 3 children, and he had appendectomy was done in 2012, and he eats junk food. Junk food is just a risk factor. Now he is having MI. We don't need to tell about he is eating junk food. Just tell me what happened to him. So he was having just chest pain that was radiating to left arm and to his neck, and you have given anything like Angie said, like and nitroglycerin, it was not relieved. So these things we should mention first. Okay. So this is urgent letter. So this is organization is very important, very, very important.
Even doctor, I think for this patient, particular
Yes,
patient MI,
yes.
the history of running nose and history of
It's
appendectomy
quite
is not that much relevant.
is irrelevant. If you write
Because
this,
it's an
yes,
it's an emergency situation. So yeah, we have
even
to emphasize on his what I did this basic management of am I given or not.
yes, these
It
things
should
we
be
should
mentioned,
mention.
right?
What are the symptoms? What this is
Yeah.
irrelevant
What are the
information.
symptoms?
Even you cannot mention after
What are
today's
the
visit. Even after today's visit, we cannot mention this because it is irrelevant information. And people, organization and layout. Just as I have marked letters for doctor, nurses, for all of you, if doctors get writing task of nurses in OET real exam, many of us will fail writing. Reason is, reason is in nursing letters they give scattered information. Scattered in over letters, patient comes with first visit, then second visit, then third visit, then fourth visit. We just organize these visits if it is chronological order of importance, then we allow sign symptom, this and this. In nursing letters, the problem is we have a lot of scattered information in organization, and layout is very important for nurses. So in this criteria, you should organize and information, and your paragraphing should be appropriate. Doctor,
Doctor,
yes,
can I,
please.
if you don't mind,
Yes,
uh, if it is an urgent letter, like a situation like MI,
yes.
the last visit should be at the top. The last
More,
visit should be at
no,
the top.
no, not only the last, the most important visit.
Visits, yeah. And
Maybe,
if it is chronic
maybe,
disease,
yes, yes,
if it is chronic disease like diabetes, newly
yes,
diagnosed diabetes, at that time maybe we can start from the in the format given, the first visit, second visit, we can follow
yes.
the
That is called
order.
chronological order.
Yeah, is it right, doctor?
Yes, it is
What I'm
okay.
saying?
Yes, it is okay. It's a chronological order. For urgent letter, we need to use order of
The last visit,
importance.
last
But
visit first.
that is not only last. Sometimes second last is more important than last one. So it is order of importance,
Oh.
the most important visit. And it is not for all, not for 100%, not 100% true. For example, if patient is having, let us see, pancreatic malignancy, that's just what today's letter I have marked for my students, pancreatic malignancy. This is they have written urgent referral to gastroenterologist. This is urgent referral, but patient is not dying of pancreatic malignancy. Means not dying mean not immediately dying. He will die after one year, 2 year, 3 year due to malignancy, but he is not dying right now. This is not like myocardial infarction. And here patient starts with losing weight and then abdominal, these symptoms, gastro symptoms, all of these things. So in that, even if it is urgent letter, in this case, order of importance would look better because to understand the situation clearly, even it was urgent letter. These things we need a lot of discussion. We will discuss in later videos. So here in organization and layout, we need to organize and paragraphing or paraphrasing. No, paraphrasing. Let us talk about paraphrasing. Paraphrasing. Doctor, Dr. Mubashir, can you paraphrase nausea? Dr.
Sorry,
Mubashir,
doctor.
can you paraphrase
Yes.
nausea?
Paraphrase nausea means actually
Paraphrase
I'm not
means
understanding what
any synonym, any similar name.
of nausea.
Yes.
No, I don't know.
Feeling
So
sick.
So
Feeling sick.
feeling sick. Okay. So this one is informal word. We cannot use. So if patient is having nausea, vomiting, okay, nausea, vomiting, fever, these things don't have synonyms. No synonyms. This is a medical letter. We don't need to use synonym. The problem is many OET so-called OET experts, they just keep teaching students tenses to doctors and nurses, tenses, paraphrasing, and punctuation and these things. They don't focus. Even you can see here at the start, languages are just one of 6 criteria. And these English teachers are only expert in language. They don't know how to write this purpose, what is important. They don't know about medical terminology. They don't know how to use this content, conciseness, clarity, what is important in every genre and style. They are not aware of most of the cases. Those who are premium providers, they are directly, trained by OET, they are okay. But other people who are not, even they also sometimes are asking about these things. So that is why you people imagine this, you people know that DrChe maximum, I try my best not to tell any lie to my students. Just believe me, it is not a lie. None of my so far, today is 27 or 28 of August. 27 08 2021, and I started coaching in December to 2020. So almost, more than 200 students I have passed in writing module with me. So none of the doctors failed in OET writing who got 10 or more letters corrected by me. This is true. Even I have a lot of evidence here. I don't need to show any evidence because uh, I can show there, it will become too long, video. So believe me, none of the reason is the way I teach. As I'm a doctor, I know what information is important, how to organize, what is clinical information, how typically we write, medical things. So it is easy for you, all of you, to pass the exam. But with these teachers, they keep teaching punctuation and this and this, and it is very difficult to pass. So your paragraphing should be logical. Sometimes people, write one paragraph of 110 words, second paragraph 30 words, third paragraph 20 words, and purpose is of 35 words, 35 and 30, 65 and 20, say 75, 85. So in total we have 195 words. What is problem with this letter, Dr. Mubashir? What is problem with this letter?
Sorry, doctor. The words first
What
para
is
110.
We have one paragraph of 110 words.
It's,
This almost
it's too
complete
long.
is too long. So this
Yes,
student's
too long.
paragraphing is not good. We should, write average paragraphs according to the situation. So over paragraphing, over organization, this organization was just, we have, discussed this one about, MI and these things. Over organization, over paragraphing should be appropriate. It should be logical. When it is logical, this visit should be written, then this visit should be written. So logical. Key information should be highlighted. Highlighted. Dr. Moshe, have you seen, these small shops? Why they put baby eating things, they were children, in front of, even not only for babies, in other shops also, in front of their shop, at the front door? Okay, why?
Because the child will see it immediately.
Yeah, then
It's
they call
highlighted.
mom, dad, I want to eat this, I want to purchase this. Okay, they will sell their things. Okay, so in OET, people, we need to highlight over things. Okay, if patient
Uh,
if patient is,
Doctor,
yes,
what are you meaning by the word highlighting? Means should be
which word?
marking what? What are you meaning by highlighting?
Highlighted.
Highlighting.
I'm mentioning this. Highlight does not mean highlight like this. It does not mean this. Okay, I'm just telling. Okay, patient is a myocardial infarction. What are symptoms of myocardial infarction? Chest pain,
Chest pain radiating to back or arm
radiation,
or
radiation,
neck. Yeah.
nausea, yes,
Nausea or vomiting
vomiting, yes,
and
shortness,
and
shortness, shortness of breath.
shortness of breath.
Okay, any other thing?
Yeah.
Epigastric pain,
And change with exertion, exaggerated.
yes, Epigastric pain, yes. Sometimes we get epigastric
Yes.
pain also.
Yeah.
And
Also.
maybe this patient is already having any problem. He is having fever. Okay. Maybe
Yeah.
he is having some edema also. Okay. So no,
Okay.
no, I am Dr. Che. I want A grade in writing, in OET writing. Just I'm joking. People, in the last video, I make a joke that in purpose, those students who want A grade, they write 2 times urgently in one sentence and urgently in second sentence of purpose also. One student was, wrote letter. He told me that you told in the video that we should write urgent 2 times. I just was kidding that if you want A grade, then you should write urgent 2 times. Okay. If I want A grade, just I'm kidding. If I want A grade, I will like Mr. Che. Okay, today Mr. Che presented with nausea, vomiting, and fever. He also had shortness of breath, edema, and epigastric pain. In addition, this is not good style. I'm just using simple and just to show you the information. It is not good way to write separate things. Okay, like this, just to teach you. In addition, he also had severe chest pain, radiating to his left arm. Now, Dr. Mubashir, this is the answer to your question of highlighting. Is this student highlighting chest pain or not?
No. He is highlighting nausea, vomiting, edema, blah blah blah.
Means this patient, the way you are, the way I am writing, it means the patient is having some gastro symptoms. Patient is having, gastroenteritis, nausea, vomiting, fever.
Yes.
I'm giving importance to nausea, vomiting, and fever. Okay. So
Now I
this,
understood, Doctor.
yeah,
I understood, Doctor.
yeah.
I understood.
Highlighting does not mean to highlight like this.
Yeah. Okay.
So this
Mhm.
today, Mr. Che presented with a severe chest pain that was radiating to his left arm, that was not relieved with nitroglycerin. And it was also associated with nausea and vomiting and a little bit everywhere. This is a little bit, okay. The main thing is this one, okay.
This
So
one,
this is
yeah, understood.
important. Yeah, this is very important. I have seen a lot of hundreds of letters. People, just what they see in case note, they start writing. If they in case note they have written fever first, they will write today Mr. Che presented with fever. If they have written vomiting next, they will write fever, vomiting. If pain is written at the end, they will write at the end. We should decide according to the situation, according to the importance. This is why people then they at the end they say I am not getting, I got 290 and I want remark $120 again. Okay, information is highlighted and subsections are well organized. Subsections mean, for example, let us say purpose is well organized, body visits, first visit is well organized, previous visits are well organized, social history is well highlighted, and past medical history, conclusion. So all of these things should be well organized and all subsections are well organized and well laid out. Okay, organization and paragraphing are generally appropriate, logical and clear. Logical and clear. This is what they keep in front of them and they mark your letters. If you don't fill full these things, these are very boring. These things are very boring to read and to understand. People will not watch these videos and they will, but these are very important. If your organization is not good, if your paragraphing is not good, you are not using logical and clear, organization. There are occasional lapses, a little bit is acceptable to get 5. And you are highlighting key information, your layout is good, abbreviation and polite language is used appropriately with minor problems, so you will get 5 grade. Anybody can read me this 3 grade? Let me take some Dr. Diana. Dr. Diana, please. Are you there? Yes, you are there. Can you talk with me? Okay, Dr. Kate. Can you talk with me?
Yes,
Yes, can you read please here?
sure. Organization and paragraphing are not always logical.
With me is not
Creating,
logical, okay?
yes. Creating string for the reader.
Stop here, stop here. What does this mean, creating strain for the reader? Let us use a synonym for strain. Let me copy here. Creating strain for the headache. Strain for the reader. Let us use creating headache for the reader. Okay. If your letter is creating headache, okay, this means strain for the reader, means reader cannot easily understand how you have organized information. I have marked hundreds of letters when I'm writing. If I don't stop when I'm reading, it means this student will get B grade. If I stop to understand what you want to say, how this information is organized and related with each other, it is creating headache for the reader. If you are creating headache in your letter for the reader, you will not get a good score. You will not get B grade. This is then you will be crying. I need, to I need what we say, this remark and these things, because you have created headache for the reader. You will not get, the common mistake is in OET, people focus on their writing, means their tenses and their vocabulary, all of these things. They don't focus on reader, means they don't make things easier for the reader. We should make reader's life easier. We should make things easier for the reader to understand. Otherwise, you will lose marks. You should not create a headache for the reader. Key information should not be, key information may not be highlighted. If you are writing in this case, MI case, if you are writing chest pain at the end, you are not highlighting, you will get 3 marks. Even your English is good and excellent, you are, a neighbor of Shakespeare, still you will get 3 because you are writing this at the end. So layout is mostly appropriate. So just let us, don't waste too much time here. Let us go to language. Language is language features means spelling, punctuation, vocab, grammar, and sentence structures are accurate and do not interfere with meaning. Okay, you should organize in such a way that it should not interfere with meaning. Minor slips in language are acceptable, okay, then still we will get 5. But if your language, you have inaccuracies in your language and punctuation in vocabulary and spelling and grammar and sentences, it will cause strain for the reader, and but still it is not interfering with meaning, you will get 3 marks. Let me just show you one common mistake that many people, there are 2 categories of students, but no, not 2 category, most of them, most of you, let us 2 categories. Number 1 is those students who use complicated language, complicated sentences. And number two are the overly simple sentences. Complicated sentences mean, let us take this example. Say if you let us today DrChe came to my hospital with nausea along with vomiting, and he also had fever associated with shortness of breath, edema, and he had epigastric pain, and his chest, his pain was radiating left arm. So it is this would be a one sentence of 50 words, and this is very confusing and not well organized. So this is called complicated sentences. We should avoid complicated sentences. We should join information together in such a way that it is easy for the reader to understand. Mostly in OET, we should use compound sentences. Compound sentences. Sometimes use simple sentences also, and some complex also. So write a mix. Most of them should be compound sentences in OET. Some should be simple, some should be complex. So instead of focusing on your sentence structure, first we should focus on communicating the clear message to the reader. After communicating clear message to the reader, we should focus on our English. So if your language is not good, you are making grammatical mistakes, tense mistakes, spelling mistakes, your sentences are not good, not well organized, and you will not get good score. So we should focus on all of these things. So if you get 2 out of 3 in purpose, 5 out of 7 in content, 5 out of 7 in conciseness and clarity, 5 out of 7 in genre and style, 5 out of 7 in organization and layout, and 5 in language, then what would be your score? Anybody? Anybody can tell me what would be the score?
B grade.
B grade, okay? B grade, okay? Not very good B, but just like 350, 60, 70 like this, okay? B grade. So if you need more, then you need about 5 plus or 6 here, 2 plus or 3 like this. But to get B grade, you should have at least this. And if you let me take 1 here, 7 here. Dr. Mubashir will tell me 7 here, 7 here, and 7 here. Dr. Mubashir, what
Yes,
would
doctor.
be the score if Dr. Che is going to exam and he is teaching and teaching, but as many of OET teachers, they don't know how the real exam, they have not taken the exam, they become OET teachers because they were teaching IELTS, and he goes
Mhm.
to the exam, he takes the exam, and
Purpose is very important.
so what will be the score?
I don't know, but
A,
it should
A,
not be up to mark.
A, B plus, these are options, B, B negative, C
It
plus.
may be B negative or C.
No, B cannot get if you get less than 2
Yeah.
purpose, you cannot
Mhm.
get B even if your rest of the letter is 100%
7.
correct, even if you are getting 7 out of 7, because your purpose is
Mhm.
not this. Purpose should be concise, to the point, and should be immediately apparent to the reader. So purpose is very important. So people just try to get at least this score. Okay, what happened here? 5 5 and 2 in purpose, at least this.
Out of 3.
So out of 3, 2 in purpose, these are out of 7, at least 5 you will get. So purpose, content, conciseness and clarity, genre and style, organization and layout, and language. 6. So when I mark letters, for example, let me show you this student. This student got 7 C negative or C. Okay, this is my real student. And after 6 letters corrected by me, she got, you know, B grade 350 in real exam. This was my student from Australia. She was a doctor. And she got 6 letters. This was her first letter, C negative or C. So here you can take she 2 in purpose, then 3 or 4 in content, 4 in third general style, 3 or 4 organization and layout, 4, and language she is getting 3 or 4. This student, after only getting 6 letter corrected by me, she got 350 in her real exam. This is true. This is not, fake, nothing else. I have marked her letter online. So people, what we should ask the listener of this video, they should subscribe to my channel or not? People
Yes,
should subscribe to my channel or not?
definitely.
Should subscribe, because they will get notification of my new videos and you will be able to watch my new videos. People, this video is boring, but it's very important, so don't forget to watch it complete. So thank you everybody. All of you have helped me to record this video, and become interactive session is a good because you ask questions, I answer them. So please subscribe to my channel. Let me share my WhatsApp number. No, it is given in the comments. So my Facebook group, a link to my Facebook group link here, not written. Okay, link to my Facebook group and my WhatsApp number is given here below in the comments. If anybody wants to contact me, contact me. Okay, you can call me, contact me, message me. Okay, on WhatsApp or Facebook. So thank you everybody. Thank you.